Howdy, I'm Princess Rycel, your isko Nars. If you happen to be new here, I guess it's time for you to subscribe to my channel where I share tips and experiences throughout nursing school. Sa video na to, pag-uusapan natin kung ano ba itong return demonstration or RETDEM sa nursing school. Bibigyan ko rin kayo syempre ng tips before and during RETDEM. So, let's get into the video! Return demo is usually conducted in skills laboratory class where your professor will show and explain how to do a specific nursing procedure or skill. Of course, he will also guide you in performing that procedure during class. Then, once you are equipped with the skill sets, you'll execute the procedure yourself, usually with a partner. Then, you will also be graded based on your performance. In the first year, you'll have RETDEM such as vital signs taking, physical assessment, administration of medications, etc. Actually, you'll be given naman a nursing checklist, kagaya na lang nitong mga to. You're going to execute every step in the checklist while dictating out loud the procedure. Then, you're going to provide the rationale or the reason why you're actually doing the step or a certain action. You'll be graded, of course, based on how well you perform each step. And again, there's corresponding grade for every step. So, you might not want to miss any single step or else you're not gonna get any score for that. Zero. So, let me show you. There's the procedure, the performance, this is the grade, and then any remarks and suggestion from your CI, and then the merit if meron kang minus point or offense. But, of course, I got you. Here's what you can do prior to RETDEM in order to ace it. Number 1, review your lessons covered during the lecture class. Your professor or clinical instructor kasi may suddenly interrupt you during the procedure to ask questions. Usually, this is to test if you know what you're really doing or how well you know a certain topic or even your patient. Let's say you're auscultating the lungs. You really have to know the differences or the characteristics of each abnormal breath sound. Malay mo, during the procedure, bigla kang tanungin about a certain abnormal breath sound and what condition mo siya possible marinig kahit pa normal naman yung findings mo. Diba, para malaman natin kung ano yung tunog ng certain abnormal breath sound, kailangan natin makinig or manood ng video. So, the second tip is watch videos. Diba your professor or clinical instructor have demonstrated the procedure during class? So recall what you have been taught and demonstrated on and take down notes on what has been emphasized as it could be asked during the RETDEM proper. Bear in mind that you'll encounter variations or differences on the executions of nursing procedures among the videos and actual demo of your professor. Even so, adhere to what has been taught to you by your professor or clinical instructor, okay? Actually, it's preferable to watch videos first before the actual demonstration of your professor. So if there's any gap or clarification, you can raise it beforehand. Third, annotate each step on the checklist. So make an outline to stay on track and plan everything you'll present from information down to the paraphernalia you'll use. You have to consider the following. First, how you're going to perform the step and what paraphernalia are needed for that. Second, the abnormal and normal findings. Third, the rationale. Kaya talaga, I prefer to watch videos first para mas ma-visualize ko kung ano mangyayari sa procedure and para mas ma-rationalize ko siya. When you write down the rationale, also indicate your reference. So, search for a textbook that can back up your rationale. Hindi naman pwedeng introducing yourself and explaining the procedure enhances learning, reduces anxiety, promotes cooperation, and prevents injury. Nyones 2021. Diba? Nyones kasi last name ko eh. Kaya ngayon, when your professor provides you a checklist, usually naman they cite also the references that also help them in constructing the checklist. So, scope those references as well. In addition, here are some of my recommended references for nursing skills and procedure in general where you can extract rationale. So now, take a screenshot, you'll need all of this. First one is Taylor's Clinical Nursing Skills, a Nursing Process Approach by Pamela Lin. Second, Cogier and Herb's Fundamentals of Nursing, Concepts, Process, and Practice. Third, Potter and Perry's Mosby's Pocket Guide to Nursing Skills and Procedures. Fourth, Temple and Johnson's Nurse's Guide to Clinical Procedures. And din nga pala, make your rational, concise, and direct to the point. Because after all, we're going to memorize that, diba? Now we're down to the fourth tip, which is memorize the steps and rationale. Memorize! 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 This is the question I often get asked. Do I really have to memorize the procedure as in step by step? My answer is hell yes! Di ko kayo tinatapture lang. However, I'm not saying na strictly word per word. Like, di naman. Basta alam mo lang yung pagkakasunod-sunod ng steps. Alam mo, mag-hand washing ka lang, 3 pages ang kakabisaduhin mo. Hand washing lang yun. 3 pages.
It was at this moment that he knew. He fucked up.
Ayoko na mag-nursing. Char lang. Parang memorization skills ko. I don't think it's just safe to familiarize because what's the point of knowing the existence of a certain information when you can't recall or remember everything about it? Pagdating mo sa random, ay, familiar. Saan ko ba nabasa yun? Familiar talaga eh. Ano na nga ba yun? Anyway, tsaka nga pala, depende rin sa approach. Meron din kasing CI na mas nagfo-focus sila na ma-execute mo properly yung steps because in reality, it's not as if na i-recite mo yung steps habang ginagawa mo yung procedure, di ba? But for others, yes, strict memorization because they are grading you based on the checklist. Fifth is practice several times. Practice doing the procedure while reciting out loud the steps as this will develop your psychomotor skills. And the more you practice kasi, the less you are likely to commit a mistake or get off track. But if you do get lost, you'll still be able to recover quickly or bounce back because you both understand and coordinate what you're doing and saying at the same time. As much as possible, don't look at any cue cards while practicing because you won't have any of those during the retdem. Baka kasi mamaya, akala mo, kabisado mo na nagpa-practice ka kasi nakakasulyap ka sa cue card pero pagdating na pala ng mismong retdem, wala ka ng cue card, wala ka ng tignan or reference, nawala ka na. Kaya wag na. Most of the time, I practice in front of the mirror. Wala lang. Gusto ko lang pinapanood yung sarili ko. Consider also practicing with your partner, especially kung by pairs yung retdem, and or someone who can guide you or give you feedback such as kakilala mong nurse, lalo na kung nagpa-practice ka ng pag-administer ng medications, IM, or IV, or ID. Diba? Alam mo, matitest talaga dyan yung friendship nyo kasi magtuturukan kayo ng medications. So, may scenario pa na kapag halimbawa mag-elicit ng reflex, sis, acting ka na lang kapag hindi ko na-hit. Oh, ganong kalokohan. Oh my God, sorry. Nabibi-ay ko kayo. Hindi ako ganun. Kapag F to F na kayo, it's no surprise to see nursing students in the hallway talking to themselves and doing odd things with their paraphernalias. Kasi, alam mo na, nagpa-practice na yan for it, then hinihintay na lang niya yung turn niya sa pagpe-present. Yung mga ibang college students na wiwirduhan na ata sa mga nursing students sa hallway. Pero wala, ganun talaga. Ganun talaga hallway kapag napadaan ka sa College of Nursing. Next naman, here are my tips during the retdem. Number 1 is delivery. Delivery is extremely important as it conveys confidence, diba? And you can only be confident if you have prepared so well, of course, by studying and practicing. Let's put it this way, how can the patient believe or trust you if you aren't even confident in what you're doing or saying, diba? Sa actual clinical setting, talagang matetest yan lalo na kapag matanong yung patient and CI mo. Also, if you come unprepared, there's also a greater tendency to fumble halfway or have a mental block. Second is know how your assigned professor or clinical instructor facilitate, direct them. Iba-iba rin kasi yung approach ng mga professors, 'di ba? Sa skills lab, usually 3 or more pa yung mga CIs or professors dyan. So, rotation lagi yung assignment doon. Siyempre, hindi na mawawala dyan na, hala sis, matanong ba? Matanong ba magbigay? Kailangan ba kabisado talaga? Like, word per word? Strict ba si ma'am? Ay, ganun. Mga ganung scenario, especially if it's your first encounter with them. As I've mentioned, sometimes you'll be interrupted midway for a question. CIs like to question why a certain steps or actions are performed in a certain way. So whenever I'm asked, I direct my answer not only to my professor, but also to my patient. May ibang prof kasi na parang, why are you explaining that to me? I already know that. Explain that to your patient instead. Kaya titignan mo rin kung yung tanong ba is tanong talaga ng professor mo o parang tanong ng professor mo na galing sa patient mo. Tignan mo yung klase ng tanong and then sagutin mo yung tanong, sagutin mo yung professor mo at pwede ka rin magbigay ng explanation sa patient mo. Again, depende rin talaga sa type ng question or preferred approach ng professor mo. Also, another thing to consider, when you explain something, assume that your partner is not a nursing student. You might have to explain everything in layman's term and in Filipino since Filipino naman yung patient natin. Let's suppose you've taken the vital signs, then your patient asks you, ano po ba ibig sabihin ng mataas na blood pressure? So, paano mo yun na-explain na maikli at madaling maintindihan? Tapos, ano rin ba yung Tagalog ng catheter? However, yung steps and rationale in English pa rin. That's how we usually do it, pero depende pa rin talaga yan sa approach sa inyo. I'm just stating things that you might have to consider or ask beforehand. Fourth, be honest about your findings. For them such as physical assessment, make sure that you really assess. Hindi lang ma-conclude na normal naman to lahat kasi wala namang sakit yung partner ko or wala naman siyang any condition eh. And sa respiratory rate, sa vital signs taking, 18 to normal. Wag ganon. Kung anong findings mo, just be honest with it. Kung magkamali ka man, at least your CI can still correct you before ka humawak ng actual patient. That's why our last tip is, be receptive to corrections or feedback. We have so much to learn. And take the feedback as a developmental opportunity rather than a criticism of you personally. And remember, a nursing skill naman takes time, practice, and experience. At the end of the day, a patient will benefit from all our patience, practice, and effort. That's it for this video. I hope you have subscribed already. That will be so much appreciated. If you have any questions I haven't addressed, feel free to comment down below. We can also be friends on Facebook and Instagram. Again, thank you so much and have a good one.